So hi, my name is Lynn Kish. I'm a librarian at the Norris Medical Library, and today I want to talk to you about locating observational studies and trials. So this should look familiar to you from last time. This is the evidence pyramid of publication types. And as you recall, from the bottom of the pyramid, we have the primary studies, and as you go up the pyramid, we have the synthesis of those studies. And also you remember that the quality of evidence, as you go up the pyramid, becomes higher quality evidence. Today we're going to be talking about the bottom of the pyramid. So those case series, case reports, case control studies, cohort studies, and randomized controlled trials. I do want to emphasize that this pyramid isn't saying that these are bad studies and these aren't as good as other studies. It's just that they're different. I know that was very Sesame Street. So what are we doing today? So we're going to define and show you how to locate case report and case series, case control studies, cohort studies, randomized controlled trials, and I'll show you how to build PubMed search skills while looking for these. And lastly, I want to introduce you to the resource clinicaltrials.gov. If this sounds like a lot, you're right. So let's get started. So I want to talk about all studies in general in this nice little chart that I took from the Center of Evidence-Based Medicine. So we can group all studies into two categories, descriptive and analytic. And we're going to start by talking about descriptive studies first. Descriptive studies are useful because they give you a picture of what's going on. And these can really focus on prevalence, incidence, and sometimes just the experience of groups of people or patients. In evidence-based medicine, we focus on case report and case series the most. So what are these? So a case report is a report of an individual patient with an outcome of interest. And a case series is really just the pluralization of this. Now you have a report with a series of patients of that outcome of interest. These are really helpful because they give you that picture, and they're especially helpful for rare or new diseases and disorders. It's very rare that you would find guidelines on something like alien hand syndrome, but if you look up case reports and case series, you'll find a plethora of information. Unfortunately, though, there is no control group for these types of studies, and so because of that, there's little statistical validity. So let's talk about where we're going to find these. I'm going to show you how to use PubMed. A lot of you have heard of PubMed before, have been using PubMed, and I just want to remind you why we use PubMed so much in the health sciences. It's hosted through the United States National Library of Medicine and the National Institutes of Health, and it's using Medline, which is primarily life science journals, online books. And there's currently over 23 million citations. I know we say million a lot these days, but I just want to remind you again, there's 23 million citations and growing. So it's really why it's the go-to source, is because it's freely available online and the vastness of the database. And lastly, I always like to remind people that you want to connect to PubMed through the Norris Medical Library webpage. By doing so, you'll see that little icon, find it at USC, and that'll connect you to full text options through the library. So you won't have to pay for the articles, at least not directly through, tuition. So that's PubMed. So let's use PubMed to find case reports and case series, and we'll do this by using the article type filter. So start here on the Norris Medical Library homepage, and the quickest way to get to PubMed is using the Quick Links dropdown, and you'll see it listed alphabetically, PubMed at USC. Give that a click, and it'll take you to PubMed. So there's two ways to search PubMed, and so for this first search, I want to do the more basic search. And when I talk about PubMed, I tend to be comparing it to things like Google, not to say it's better than Google. Again, it's just really different, and it behaves differently. So let's do things about case studies and case series on, quitting smoking and smoking cessation. So if we type in quit smoking, here we get over 8,000 articles about quitting smoking. And let's add pharmacotherapy. Let's find out which drugs are best used for quitting smoking. Okay, so now I get a little over 1,200 results. And you can see from the titles that these look like they're related. Smoking behavior among patients and staff, major metropolitan hospital, and what is being used. Now, if you want to know how this search worked, if you scroll down here to search details, you can click see more. So this is what I mean how it behaves different than Google. This is what we call automatic term mapping. So PubMed recognized the words that I put in and made recommendations based on that. So it understood the word quit, did an all field search. It also understood the word smoking and attached a mesh term. It also saw that I put pharmacotherapy, and it's like, I think you meant drug therapy, and it did that all for me. So PubMed is doing more than just what you type. So sometimes it's good to check those out to see exactly what's going on. Now, if I want to look for just the case series and case reports, I can go over here on the left and use these filters. I can go under article type, and right now there's clinical trial and review. If I click more, that'll generate an alphabetical list of different study types. And I'll see right here, case reports. If I click show, now it shows as an option, and I can give it a click. And now I just have 12 results, and these are all case reports or sometimes case series that address my question about what's the best treatment in terms of pharmacotherapy for quitting smoking. Okay, so let's talk about this other branch on our chart. Now let's look at the analytic studies. Analytic studies are different from the descriptive studies because now instead of just giving a picture of what's going on and what people are experiencing, analytic now tries to quantify a relationship between two factors. So the first category we're going to look at are observational, which is what it sounds like. It's when you look at what's going on and you report on it. And let's talk about case control studies and cohort studies. So a case control study is when you compare patients with a specific condition to people without the condition that are just naturally occurring in life. You're not going to put them in a lab, you're not going to interfere. Cohort study is when you identify a group of patients under treatment or an exposure and you follow them forward over time and then compare their outcomes with a similar or unaffected group. So these are really great because they are ethically safer, easier, and cheaper than setting up something like a randomized controlled trial. But because you have no control over the environment, there's no blinding, there's no randomization, and consequently, there's those hidden confounders that Dr. Samet addressed. So let's find those in PubMed. And this time, instead of using the article filter type, we're going to be using mesh terms. There's two ways to search PubMed. One was using just key terms, a basic search, using automatic term mapping. The other one is to use mesh terms. So this is a slightly more advanced way. MESH stands for medical subject headings, and it's the controlled vocabulary of PubMed. So a way of thinking about this is that we know in medicine we use a lot of different terms for the same thing. Someone might write a paper about lung cancer, and one might write a very similar article about lung neoplasms. Rather than putting that burden on the searcher using PubMed to come up with all those possible synonyms, you can use that controlled vocabulary and they're all going to be branched under that one term. What's really neat about MESH is that it's not a computer or an algorithm. An actual person reads every article that goes into Medline and decides what the article is about and attaches these terms to it. So if you want to use MESH, you'll select MESH from this drop-down menu and search for your terms. So let's go back to our quit smoking. Okay, so this is what's kind of neat about MESH is that it took my quit smoking. Now quit smoking doesn't exist exactly in MESH. What they call it is smoking cessation. So if we give that a click, you'll see that it has a definition. It has a list of subheadings. These can be used to narrow my search. So for example, if I wanted to look at methods, I can choose just that. If I don't click this, it's going to search for all of these at once. Here we have the entry terms or synonyms. And lastly, here's the hierarchy that runs behind MESH. So if I wanted to broaden my search, I can go up. I can talk about just all tobacco use as opposed to just smoking cessation. And actually for this question, I might consider using tobacco use cessation unless I want to focus on just smoking. Once I have what I want, I click Add to Search Builder, and then I can continue using MESH. Now, I remember seeing something on there that looked good as well. Okay, number 4, tobacco use cessation products. That's pretty similar to my methods of smoking cessation. So I'm going to add that to my search, and I'm going to use OR and see how it added it to my search builder. Okay, so now we can search PubMed. And you see it still remembers my case report filter. To turn that off, I can hit Clear All or just click it again. So now I get, almost 7,000 articles. So if I want to look just at case control studies and cohort studies, I can add that using MESH. If I looked for it under article types, you'll see that it's not listed. So let's return to MESH. And let's type in case control study. Okay, so here it gives me that definition, those subheadings, and here again, all the synonyms. And here, like I mentioned, hierarchy, you can go up to broaden it. You could also narrow by going down and focus on retrospective studies only. By searching case control studies, I'm already going to be searching for retrospective studies as well. So I like this. Let's add it to my search. And now let's also add cohort studies. Maybe I think both are great. So we'll add that with an or. And there you go. You can see we have a big number this time because this is now everything in PubMed that's a cohort study or a case control study. If I want to add that to my previous search, I can find it. This is kind of nice. PubMed remembers everything you did. Hit advanced. And here we go. Here's my smoking search using mesh. Let's add that. And now let's add the case control studies with and. Now I'm going to find things that talk about smoking cessation methods that are also case control studies or cohort studies. We'll hit search. And there you go. I have almost 1,100 articles. Now, I think it's a point to make while we're looking here at PubMed is looking over almost 1,100 articles doesn't sound very realistic to me. So this is where you can continue using these filter options here to the left. The one I always like to use first is the language filter. Because je parle français, but I do not parle medical français. Okay, so that got rid of a good number. And maybe I just want the most current information. I can go to publication dates and click 5 years. Now I have 396. This is a much more realistic number to browse through, see what looks interesting to me and what's going to help me with either my research or helping my patient. So that's how you can find case control studies and cohort studies in PubMed. So now we've located case control studies and cohort studies in PubMed, let's return to our chart of the study types. So now we have analytic branch. There's not just observational, but there's also experimental, when you start controlling the environment and who is included and not included. On this, we have all different trials, and I want to emphasize that we're talking about randomized controlled trial. Not all trials are randomized, and so we're going to focus, though, on randomized controlled trials today because they are statistically better. So randomized controlled trials. The definition is participants are randomly allocated in an experimental or control group and followed over time for the variables/outcomes of interest. So an ideal randomized controlled trial will not just be randomized, but will describe their randomization process and will also include things like blinding. Where both the patient and the doctor, double blinding, do not know who's receiving the experiment and who is receiving the control. This process helps counteract bias and makes statistical analysis possible as compared to the observational studies we looked at before. So let's talk about how to find these in PubMed, and we'll be able to use an article type filter this time. Okay, so let's go to advanced to get my nice little mesh search I came up with. All right, and so if I want randomized controlled trials, you can look at this list. Now you'll notice that clinical trial is showed by default. That'll show you all trials, ones that aren't randomized as well. So I like to go down the list and choose randomized control trial. Now if you select that, I now have 1,400 articles. If you want to filter that, I could recommend again looking at the most recent information, the recent 5 years. You might also consider the population you're looking at and look at ages. If ages isn't showing, click Show Additional Filter and choose Ages. But you can do children, which would be kind of sad, but adolescents you might want to consider. Or adults, all adults over 19, middle-aged adults, aged adults. And that can help get your question to be more specific and also hedge down your results. So if I choose aged, 65 years or older, there you go. Now I have 116 articles from the past 5 years that are randomized controlled trials. So you can start browsing through these and seeing what looks most helpful to you. So an important question, are all trials published? I'll give you time to think about it. No, they're not. Some reasons for this are not all trials are completed. Not all trials go through the process of publishing their results. It's a pretty arduous process if you've ever published before. But lastly, a lot of the time trials have negative results. It shows that a drug or treatment had no effect. That tends to be less attractive, less exciting in terms of your scientific career, and they go unpublished, but they should be available to us because that is information that will help you treat your patients. So I want to show you a resource, clinicaltrials.gov. This is, again, through the National Institutes of Health and the National Library of Medicine, and it came about through the 2007 FDA Amendment Act that required drugs and devices to post their results on clinicaltrials.gov. They have to include abbreviated summary tables, and they have to put this up within a year of completion. It sounds great. It sounds like it really resolves that issue of not having all the data available to clinicians, but there are some problems. It only starts with trials in 2008. They only include trials for label use only. So for example, if you had a drug that was an antidepressant and it was being commonly prescribed for adolescents and was never tested for that, it wouldn't be on clinicaltrials.gov. And lastly, a study from 2012 showed that only 1 in 5 trials are compliant to posting on clinicaltrials.gov. So we aren't getting all the data just yet. So the kind of point I'm making when talking about these different things and evidence-based medicine is I just want you to all walk away understanding that you cannot rely on information being accurate solely because it was published in a peer-reviewed journal. This is where evidence-based medicine comes in, because you're finding the information, you're assessing the information, you're doing more than just saying this was published in JAMA or this was published in Lancet, therefore it's good. So to bring it all together, I just want you to understand that that process that I mentioned, ask, acquire, appraise, apply, assess, these are all combating these issues of publication bias, where things are being unreported or data is incomplete or trials are just poorly designed, and even the practice of ghostwriting when a pharmaceutical company will write a report that then an academic will publish as their own. Because it's not just about what you do individually, I like to add another A to my steps, and that's advocate. So you're really advocating for evidence-based medicine. If you really believe that this is important for you and your patients, this will be something that you advocate for throughout your career. So just going over all the stuff we talked about today, we defined and located case reports and case series, case control studies, cohort studies, and randomized controlled trial. I hope today we got to build up on your PubMed search skills, and I hope that you learned more about clinicaltrials.gov. So thank you for your time today. I look forward to talking to you again soon about systematic reviews.